So as a physical therapist, I spend a lot of time working with alignment. And what I've discovered over the years is that I think most of us think too small about alignment. Well, and my background is in treating complicated chronic pain patients and others who have not found success within the medical systems. This has evolved as a result of kind of my own detective work and problem solving their cases over the years. So as your vagus nerve comes out of the base of your skull, it goes down and innervates the pacemaker cells of your heart. It loops underneath your aorta on the left and your subclavian artery on the right and goes back up to innervate your vocal cords and swallowing muscles. It's really involved in all of your senses. It travels down your esophagus through your diaphragm. It innervates the muscles of your digestive system. So it innervates the muscles that move the food through your digestive system. And it goes all the way down into the pelvic area. In women, it innervates the cervix and clitoris as well. Beyond that, you cannot absorb vitamin B12 without your vagus nerve. It also mediates inflammation, and so that's been a huge part of why it's been so important to me as a physical therapist. Because the story often goes like, oh, I had a twinge here and I was feeling kind of tight or whatever, and then were a couple other small incidences, and then there was a big episode that made it much worse. And when you have those little, take those little moments of your body talking to you and go, oh, I need some attention, like I need to get my rotational alignment back, that I find that that's very, these exercises are very powerful. And I think, and they're so simple in the big picture. And really, if you can't remember the positions, you're somewhere and you're not in this video, and just exhale as long as you can. Doing a really long exhale, that can be super helpful at loosening up even your hips. To assess yourself, the first thing you're going to do is just check how your head turns side to side and see if you're symmetrical or asymmetrical. Okay, if it's how it feels, when you get to the end, if it feels like a brick wall, or if it feels soft and springy, it ideally should feel soft and springy. I don't have anybody do usually every single exercise. Usually there's a couple that are the most needed. And so you can absolutely play with this and see which ones give you the biggest change. If I was going to pick two for you, like I would say the diaphragm one that was like this and the ear pull. They're great if you zigged when you should have zagged, or like you helped a friend move furniture and that's not something you normally do, and you think, oh, I'm going to pay for this later. Those two are really nice at kind of resetting that. If I was going to throw a third one in, I would say the breathing into the backside of the heart. Like those three will, I would say I teach most often, or I see stuck the most, and they yield very wide benefits.